the modern times, you know. Again, Linda Mama, that was here, that was brought by Uhuru Kenyatta. We want our women to give birth with dignity. It was scrapped. I would reinstate Linda Mama. I would also like to work very closely with the private healthcare providers and faith-based organizations. The church, the Catholic Church, they have beautiful hospitals, mission hospitals. The PCA Church, they have beautiful hospitals. We need to support the church. You know, like now, since NHIF was scrapped, there were owed billions of shillings, they have never been paid. Most of those hospitals owned by the church are almost collapsing. This is something that we must work on. Again, we must remunerate properly our healthcare providers. We must make sure that the doctors and the nurses and the clinical officers, they deal with human life. People who deal with human life are not your ordinary work. These are people who are dealing with life. These are people who need to be settled. They need to be well taken care of, and we need to have a discussion with them. We need also to expand the universal health coverage so that we make sure that the level 2 hospitals, that those are the dispensaries, and the level 3, the health centers, are properly equipped. You know, my brother, most of these cases that come to level 4 hospitals for admission and level 5, if there was proper intervention at level 1, 2, and 3, they will never get to the level 4. You know, but these cases get bigger because they don't get the proper attention. I would like to focus more on level 2. Those are the health centers, and level 3. The level 2 is dispensaries, level 3 are the health centers. I would like to focus more. And then again, the level 4, we make sure they are well equipped. And we will go a step further by making sure every level 4 hospital in the country has a ward to deal with rehabilitation of addicts. Because we have a serious challenge of drug addiction and alcoholism in this country. And the treatment of addicts is very expensive by the few health providers who are doing it from a private perspective. We would like every level 4 hospital to have a ward, you know, specifically dedicated to deal with addiction. Again, we would like to digitize, you know, our health systems so that, you know, if you saw one doctor and you go and see another because you are far away, at the touch of a button, they can get your medical history.
Does this mean that you get in and you get rid of SHA? Because yesterday I had a discussion with the PS, Dr. Oluga, and he said that the government is working on a database where all the information for Kenyans will be in a single database, such that whenever it is you go in this country, you will still get the information. So Gachagua, does it mean you get in, you get rid of that and start afresh?
No,
and what
no,
happens to the investment that Kenyans have put into putting in place SHA?
Whatever is working will improve on it. Yeah? But first we have to stop the theft. We cannot improve on the theft, we can only stop it. Theft of public resources is our main challenge, especially in the health sector. You know, and SHA is a scam. It's a fraud. We must get rid of SHA because from the inception, it was tailor-made and birthed to steal public funds at the expense of the health of our people. We must go back to NHIF and improve it, panobit it, and make it compliant to the modern way of doing things. But we cannot continue with this theft. This, we must bring it to an end. Again, we need to implement a mental health policy. You know, we only have one medical facility here in Mathare and a few others. You know, and you know, mental health is a big challenge in this country. But you see the way people are treated at that institution, it's like they are criminals. Because it's only one institution to handle so many people. We need people to know that mental challenges is not a crime. And you should not be embarrassed about it, so that even relatives know. And the only way to do is to have a good mental health policy and to make sure that we have enough psychiatrists in every level 4 hospital where people can go on and get counseling before issues get out of hand. So these are some of the things we like to do. And of course, what was signed in America is unacceptable.
Why?
We cannot sell our medical data to foreigners. We cannot. Even if we are poor, we have our own dignity. The right to privacy is absolute. We cannot give our medical records to the Americans for their own research and analysis using our records. And I think it is very inappropriate.